As we've learned, connecting to mental health care often begins with a conversation with a primary care provider. Here to tell us more about that is Dr. Robert Sedlacek, a family medicine physician with ThedaCare Physicians, Wapaka. Thanks so much for being with us.
Thank you. It's a pleasure to be here.
So our very first question here, can you just explain what you're seeing when it comes to mental health care?
Last year, 21% of adults reported some form of mental health issue. 5% of those were severe mental health issues. That's around 50 million Americans who had some kind of mental health issue. When it comes to kids, we're seeing about 16% of adolescents reporting a major depressive episode in the last year. Unfortunately, for both adults and kids, there's not as good access as we'd like to see.
So as a primary care provider, how do you help people and how do you assess their mental health?
Frankly, it just starts with asking. In the clinic, we are routinely screening adults for anxiety and depression. We also have a set of tools for screening for substance use, which so often coincides with mental health issues. Opening that conversation can be challenging, but the screening tools do a good job of sort of alerting us to patients who are maybe struggling or having troubles, and then drilling down a little bit into that, trying to sort out what is this that they're experiencing.
What's the connection between someone's mental health and their physical health?
To put it simply, the brain is an organ of the body. The mind is an output of our brain. If there is physical illness, then the mental illness tends to follow, and vice versa. If there is a disturbance in the psyche, in the mind, then we often see physical symptoms that follow, and it's usually that physical symptom that gets someone to come in. I very rarely have a patient who comes in saying, I think I'm depressed. But oftentimes they'll come in and say, my stomach hurts and I'm not sure why, or I'm feeling kind of foggy or cloudy and can't quite focus, or I'm having trouble sleeping or eating.
So all those things are connected.
Absolutely.
Okay. So as people go throughout their lives, there are different times that can increase a person's risk for maybe experiencing a mental health challenge. Can you explain what those times might be?
This can happen in any number of factors. A financial crisis that someone experiences, a transition like a change in job. It doesn't always have to be unhappy events. Someone could have gotten a promotion and find there's new stressors at work. They could have had the birth of a child, a change in the nature of their relationship or the relationships around them. All of those may lead to a mental health issue.
Okay. So when it comes to our mental health, what are some steps that maybe you recommend for improving our mental health or our coping skills?
I offer to you that I think of the mindfulness side of things in the same way that I think of recommending physical exercise for patients. As we exercise our body, we also should be exercising our mind. And there's a whole range of ways you can do that, from things like mindfulness meditation or journaling, and then interpersonal interactions. And those also run the gamut from maintaining healthy friendships and seeking out social interactions, clubs and groups and hobbies that we develop, to more formal settings where we may seek out a counselor to help us understand why we think the way we think or why a particular problem seems to keep coming up.
Okay, those all seem like little things that maybe we can all do and work toward to improve our mental health.
Absolutely.
All right, Dr. Sedlacek, thanks so much for being with us today. We appreciate it.
It's my pleasure.